Welcome back to Face the State. I'm Ariana Bennett. Thank you for keeping it here. On the last segment, we got a good look at the situation our public agencies are facing when it comes to managing homelessness. Now we'll look at plans in the works to bolster those efforts. So I'm back with Travis Sandifer and Ryan Gustafson to talk about some new solutions. Thank you both again for your time.
Absolutely.
All right, so first one, Washoe County recently opened 50 new units of permanent supportive housing. Can you explain how that's different from the options we already had?
Absolutely, yeah, and super exciting for us to be able to open those 50 units. It's 50 units, actually 65 beds, so there's some ability to double units up if you have a couple that happens to be in the unit as well. It's real exciting and a little bit different in that if you think about things like a Section 8 or some other voucher type programs, this looks a little bit different, and that there is some of that that's entailed with permanent supportive housing, but it's a lot more intensive than that. Typically, to qualify for permanent supportive housing, you will have some unique needs, whether those be mental health needs, maybe some physical disabilities and physical needs, but it's for folks that have a much higher need than perhaps the more generalized population. And so with permanent supportive housing, the good thing is that there's a lot of wraparound services that come around you. So you might have mental health services, clinical services, you might have psychiatric services, you might have medical services. And with the program that we just opened, we're real excited because we actually have nurses that are county employees that are serving this population.
Right there on site?
Yes,
Wow.
yes, and that's really fantastic for us. And then we have case management as well, and case managers that are assigned to this population as well. And then we're working on psychiatric care for psychiatric needs as well. So we really want to be able to wrap that case management, those medical services, those mental health services around this population, because it tends to be a population that needs a little bit more intensive services.
Yeah. It's so needed, and that service component is just absolutely critical for some of these individuals who need that little bit of extra assistance to stay stably housed. And to give you one example of that, so we have a pilot project over at the Village on Sage Street in partnership with Anthem. And that pairs case management with the housing function for people with more complex needs. We have seen 90% reduction in ER visits, 90% reduction in hospitalization. And so like you think about just the human impact, let alone the impact on the system of helping to better coordinate the right kind of care that's individualized for the needs of that person. It's just so needed.
It is, and you know, I think you make a great point, Travis, in that we're real sensitive to and really want to honor like the systemic need in our community. So when you talk about the fire department, law enforcement agencies, REMSA, hospitals, those things have a finite amount of resources that they can offer, and we want to make sure that those are reserved for when they are absolutely needed. So when you can put something like permanent supportive housing in place and be a little bit more preventative and have some of those that wraparound care and have a case manager that's able to work with you and a therapist that can come in and see you and come to you where you're at, makes a real big difference on that preventative side and not needing to be reactive and call 911 or call REMSA, call ambulances.
Yeah,
Right.
absolutely.
At the ribbon cutting, one of the county commissioners there commented that we need 1,100 more of these units. So 50, maybe 65, great start in this direction, but we need 1,100 more. That is a lot. So how does one go about getting something like that? Is that feasible?
I certainly think that it's a community-wide effort that's needed. So, you know, we're, as Washoe County, I'm super honored and proud to be able to partner with entities like VOA and entities like Catholic Charities and Karma Box and all of the strategic partners in the cities that we're able to work with to get those, not just permanent supportive housing, but also just affordable housing in place. 50 units, 65 beds, that's step one, you know, for us. There's actually another building that's incoming just behind that that's currently being constructed now. That's another 120 units. A number of those will be specifically dedicated for this as well. But yes, you're correct. There's an ongoing need to increase our capacity in this community.
Yeah, and we have 26 more units going in across the street there at the Highway 40 Motel that we're renovating, scheduled to finish Q1 of 2026. And it feels at one level like a drop in the bucket when you hear the 1,100. but it's bit by bit with every single partner. The state of Nevada has pioneered with AB 310 and other funding sources to help support permanent supportive housing. And I think if we can help make the case to the community to look over a long arc of time, the savings to the community by investing in that type of housing is going to be massive. But that takes 10 to 15-year time horizons.
Yeah. I mean, I did a story once where they ran the numbers and they showed, you know, each day that a person is on the streets, this is the amount of public resources it costs. So in terms of police response, REMSA response, ER visits, this sort of stuff, versus how much it costs to construct something like a tiny home, like the Village at Sage Street kind of structure, the little, I guess that one's more dorm style, but the tiny homes, I can't remember the name.
The Mod Pods on the safe camp.
Yeah, those they seem expensive on the outset, but they're so much cheaper when it comes to the use of public resources in the down the line. So it is a pragmatic solution. Now, there's been some changes to federal guidance when it comes to handling homelessness. The Trump administration handing down some changes in terms of kind of not looking at this. We've always done this housing first model, or at least for many years, saying they don't like the housing first model. They want more of a requirement for sobriety first, emphasis on treatment first. Is this going to change any of your policies?
You know, I think that's a great question, and I certainly we're at a monitoring stage where we're sort of watching federal guidelines as they come down. And they trickle down to the states, and we adjust accordingly as we need to. I think that I think it's important for us to, again, to be able to process people through the system, and is sobriety an important key of that? Ultimately, yes, it is. We want people to be successful. We want people to be sober, healthy, happy, and productive. So we've also been fortunate to constantly be willing to evolve as we need to. And Travis and I, in the last weeks, have had a lot of conversations about what is accountability measures? What might those look like for us to help people get processed through? How can you motivate people to want to come, you know, if they run on hard times and happen to come onto the CARES campus, how do you help motivate people to sort of work their way through? And we have some of those things in place. Again, there's expectations for folks that come in, and to your point, with federal requirements is, you know, how do you, what does it look like for those expectations? Like, you want people to be motivated, and we have some of those in place. There's an expectation that you're going to work a case plan, that you're going to work with your case manager, that you're not just going to perhaps sit in a bunk, you know, for 5 years. That's not, you know, that's not in our game plan either. We want people to work with their case plan, work with their caseworker, for us to be able to assess what your needs are. Are they substance abuse treatment needs? Are those mental and behavioral health treatment needs? Is it skills for employment that we need to help you with? Do you need generalized, you know, some medical care, dental care, all of those things? You know, do you need, you know, is it because you can't get down to the DMV? I mean, there's little things that you don't think of, and we're trying to be really sort of all-encompassing, where we're like, no, we want the DMV to come on site. We want eligibility folks, because people who come in, there's a variety of insurances that folks have, but there's a big percentage of people that come onto the campus that don't have any insurance at all. And so for us, it's like, can we bring in state eligibility folks to figure out what your needs are to maybe get you insured? So all of those things that we're really trying to have a real comprehensive system to meet people where they're at.
Yeah.
Any concerns then about things like cuts to Medicaid or cuts to federal funding that could impact both the volume of people you might have coming to you for help and the ability to meet the need financially?
Yeah, I mean, you certainly look at the system as a whole, and you get concerned when you see safety nets go, and whether you can see an increase in individuals coming into the system, chasing after more scarce resources. I think one of the things that I share with our team frequently is that we've been around for over 100 years. You have to be ready and willing to adapt to the times. We have to rise to the occasion. You have to continue to innovate. You have to be entrepreneurial. You can't rest on your heels and get in the habit of this is the way we've always done things. We have to constantly be in that mindset, and so we're willing to take whatever comes, and our North Star is ultimately to help the people that we serve, and we are going to find the different resources and piece them together to help them get to where they need to go.
And I think it's an understanding, because we are doing a lot of cutting edge things, and we are one of the larger shelters, certainly on the West Coast, that we're in the forefront of this. And so will mistakes be made? Probably, sure. Have there been? Yep, there are, but that's okay. And it's to figure out, okay, how do we learn from this? How do we change? How do we evolve? How do we grow from this to serve our community as the community needs continue to evolve and grow? To your point, as you see, entitlement programs maybe change or get modified at a federal level as there is sort of a chasing of already scarce resources. You can see people that come in with maybe there's food insecurities, but maybe there's medical needs tied to not having insurance, so you're not willing to go to the doctor or go to the hospital because you don't want to land a big bill. And so I think those things we continue to monitor and sort of watch change over the months, over the years, and we just want to be able to change with those.
Yeah.
All right, well, we have just a minute left. I know we could talk about this for so much longer, but just quickly from both of you, as quickly as possible, if there's one thing, top of your wish list, number one thing you want, what would it be?
I would love for the community, when you drive down 4th Street, to both take pride in what this community has built and compassion. Show compassion to your fellow neighbors and citizens.
Yeah, I mean, we call it the corridor of hope down there, because there's so many programs and there's just so much importance in the work that we do, and the staff that works for Travis, that works for the county, they care about humans, and just a recognition of the hard work that we do, and also making sure that the community's involved.
All right, both of you, thank you so much for your time. I sure appreciate it.
Thank you.
Thank you.
That is it for this episode of Face the State, but for more information or to see past episodes, you can head to our website, that's 2news.com. Thank you so much for being with us. We'll see you next week.